और ये है आपके पास इंटीरियर टेक्नोलॉजीज, ठीक है, विच इज़ ऑल्सो कॉल्ड पापुलाइटिस। अब इसमें हम ये देखते हैं कि हमारे पास 3 तरह की चीज़ें हैं। एक तो यहाँ पे नॉर्मल फंडस है, एक हाइपरमीक फंडस है, और एक फंडस ऐसा है जो बिल्कुल ही ख़राब हुआ हुआ है। तो यहाँ के पास इंटीरियर टेक्नोलाइटिस है, ये है रेट्रोबर्गर, और ये आपके पास यहाँ पे सारा का सारा फंडस ख़राब हुआ हुआ है। अच्छा, इससे पहले हम ये देख रहे थे कि आपने मोन्यूमेंटल स्कोर को कैसे डिसाइड करना है कि कौन सा जो है आपने स्टाइकोमेट्री देना है या मोमेंटाइन देना है। तो अगर तो पेशेंट का मोन्यूमेंटल स्कोर अच्छा है तो फिर आपने उसको देना है एस इनहिबिटर्स, और अगर उसका मॉडरेटली सीवियर है तो फिर आपने उसको मोमेंटाइन ऐड कर देनी है, मगर अगर 10 से भी कम है तो आपने मोमेंटाइन ही देनी है सिर्फ, और कुछ नहीं। Okay. अच्छा, 45 years old, 7 months history of pain in his feet. He had increased difficulty over the same period of walking and had fallen over a number of times. Suffered from gastroesophageal reflux, for which he used to be lansoprazole, and his only child, both parents had died when he was young. There no wasting, gesticulation tone was normal throughout, mild Cooper weakness in all 4 limbs. He was areflexic with a loss of vibration proprioception sensation to the wrist and knees bilaterally. अच्छा, वाइब्रेशन proprioception जो है वो wrist and knees को कम है. Okay, nerve conductions or motor conduction velocities were less than 60% of normal. Distal motor latencies were prolonged in 3 out of 4 nerves. Acha, there was one region of nerve block in the median nerve. F waves were absent. Charcot Meredith, vasculitic, drug induced, CIDP, या फिर vitamin B12 deficiency. ठीक है, कंडक्शन की वेलोसिटीज कम हैं, मतलब डीमाइलिनेशन हुई है. डिस्टल मोटर लेटेंसीज वर प्रोलॉन्ग्ड, and there was one region of nerve conduction block in the median nerve. Global weakness in all 4 limbs, and he was areflexic, with loss of vibration proprioception to the wrist and knees. CIDP में ऐसा नहीं होता, विटामिन B12 डेफिशिएंसी में हो सकता है. लेकिन CIDP में भी हो सकता है अगर वो लॉन्ग नर्व्स एक्सोनल मायोपैथी हो ना. और इसको ये कब से हुआ? 7 मंथ से ही है. ठीक है, CIDP में होता है कि डिक्रीज मोटर कंडक्शन वेलोसिटीज, prolonged distal latencies, absent or prolonged F waves, and areas of conduction block. हम ये लिख लेते हैं अब CIDP के साथ. He was diagnosed with simple migraine 3 years previously, and in the last 18 months, attacks have increased in frequency and changed in character, and now described a daily headache that presses on temples. 33 है सिंपल माइग्रेन था उसको पहले frequency बढ़ गई है change in character and now the headache is pressing on the temple. The pain worsens as the day progresses and there is no relation to movement or posture and there are no associated neurological symptoms of pain. It says that it has increased the user analgesic considerably and a time consultation is taken because PCM diclofenac hydrocodone step down withdraw regular analgesics. A right-handed smoker is referred by his GP for assessment likely stroke in his 5 years tried with sudden onset of left-sided weakness and bumping into objects on the left. Patient's agitation prevents you from driving the field effect further. Admit him to the ward and organize brain imaging while waiting imaging. He is by neuro-ophthalmology team, a formerly plotted a which of the following visual defect the right-sided body weakness है और सेंसरी इनअटेंशन है तो ये आपके पास आ जाएगा आपका राइट लोब का इसमें आपके पास होगी राइट इंफीरियर होमोनिमस हेमिनोपिया अच्छा राइट इंफीरियर क्वाड्रेंटोनोपिया होगा इंफीरियर क्वाड्रेंटोनोपिया 60 years old woman is brought to the hospital with 2 day history of left-sided headache, blurring of vision. She does not usually suffer from headache and finds the patient persistent pain worrying, and her past medical history includes type 2 diabetes, hypertension. Previous clinic letters suggest non-compliance with medication. 65 and 85 in the remainder of cardiovascular and macroneurological show the following. We have doses and meiosis. राइट साइड को देखना है लेफ्ट साइड को देखना है लेफ्ट साइडेड हेडेक एंड ब्लरिंग ऑफ विजन राइट को इग्नोर करो लेफ्ट को देखो इसमें प्रोसेस भी है प्रोसेस क्यों होता है दो वजह से होता है या तो आपके पास सिंपैथेटिक्स काम नहीं कर रही है या थर्ड नर्व काम नहीं कर रही है ठीक है टोसिस के साथ मियोसिस आ गया है तो इसका हॉर्नर्स बन रहा है टोसिस मियोसिस करके आर्टरी की तरफ जा रहा है ठीक है 24 years old woman is referred to the neurology with a 6 month history diffuse headaches and initially began as occasional pain occurring only certain times during the week. It has increased, however, to the point where it is continuous. एक्ने के लिए फ्लॉक्सिटिन और कंट्रासेप्टिव टेट्रासाइक्लिन ठीक है आगे आना हेडेक्स के लिए ठीक है फिर स्टेज 1 papilledema affecting both eyes. There is enlargement of blind spot with some diplopia on the left lateral gaze. And BMI is 32 मोटी भी है वो ठीक है स्वेल नहीं है CSF ओपनिंग प्रेशर पे ज़्यादा है वाइट सेल्स कम है रेड सेल्स नहीं है ग्लूकोज भी ठीक है प्रोटीन भी ठीक है तो अब हमने सीरियल CSF पंक्चर्स नहीं ओके stop tetracyclines, vitamin A, stuff like that. Okay. Next best step in management, which is at 7 years old woman comes to the genetics for review and she suffers from muscle weakness, bilateral ptosis and cataract. वीकनेस है और टोसिस है कैटरैक्ट है ठीक है born blue and required assistance with breathing during the first few minutes after birth and child's father had history of cataracts but is otherwise well. He was born blue. Galactosemia ही है right? Myotonia dystrophy which is to cataracts. So why the baby is blue? Congenital baby can present with respiratory difficulties at birth, which might explain the blue appearance. अच्छा लगा शायद कुछ स्किन का मसला चल रहा है due to lack of adequate oxygenation. This stress can affect the muscle tone and strength. ठीक है congenital है ना इसलिए होगा ऐसा. ठीक है let's add. That's a 34 years old man complained of a 6 months history of feeling depressed and a feeling of people following him wherever he goes. He had previously been well and been taking no prescription medical medications, although he admits to smoking cannabis since beginning a teenager and more frequently in the last 6 months. It's a 6 months history of feeling depressed and a feeling of people following him wherever he goes. He has been well and taking no prescription medication, although he admits to smoking cannabis. And ठीक है, he was no longer hearing that his father had committed suicide. ठीक है, अच्छा, on he had infrequent facial grimacing, writhing limb movements, stone power reflexes were on normal. Cleaning examination was on, apart from slow saccadic eye movements, difficulty maintaining trunk protrusion. Genetic studies copper facial grimacing, writhing limb movements, saccadic eye movements, and difficulty maintaining tongue protrusion. Difficulty maintaining ये तो जैक इन द बॉक्स वाली चीज़ हो जाती है ना. इसके लिए हम प्रॉपर स्टडीज़ कराएं. कोरिया है ना इसको, यह टेस्टिंग करा लेनी चाहिए हंटिंगटन देखने के लिए. अच्छा 78 years old gentleman known in China presents complaining of difficulty in walking, which is worse throughout the day. Angina, we had difficulty walking, which has gotten worse throughout the day, and he does not complain of back or leg pain, and there is no history of trauma during his stay in A&E. His condition deteriorates, and after 4 hours, he is unable to stand and complains of being unable to pass water. Angina, ठीक है, complain difficulty of which has gotten worse throughout the day. ठीक है, he's found to have flaccid paralysis, hyperesthesia, and dermatoma and desensation below this point. मतलब कोई vascular event हुआ है vertebral artery का vibration proprioception intact तो ये anterior spinal artery है ना. अच्छा, 20 years old right-handed homeless man, right-handed है, he is admitted with history of headache, malaise, worsening 6 to 8 weeks. There is history of previous submission to 2 weeks earlier with confusion, but he self-discharged against medical advice. Confusion भी चल रही है, malaise है, headache है. Drowsing, confusion, neck stiffness, and positive burnings. A fundus examination reveals pink optic disc, hyperemic pink optic disc. He has ptosis of right eyelid and right eyes deviated down and lateral. मतलब third nerve palsy हो चुकी है इसकी right side पे. Pupils are round and reactive to light and accommodation. Blinking is um, reduced on the left side, and the usual fold on the left side is smoothened. Facial nerve भी गई और third nerve भी गई. White cells हैं 6, सोडियम कम हुआ है, यूरिया इज 7, 5 CSF का ओपनिंग प्रेशर जो है वो 280 बढ़ा हुआ है, 128 वाइट सेल्स, 9% लिम्फोस, प्रोटीन्स 3.8 है, ग्लूकोज सेverely कम है. ठीक है, रिड्यूस डायरेक्ट वेंट्रिकुलर सिस्टम एंड एनहांसमेंट ऑफ बेसल मेनिंजेस. बेसल मेनिंजेस आ गई हैं तो फिर ये TBM है. Woman presents to emergency room with complaints of headache, neck pain, and says started. It started on waking 12 hours ago. Headache, neck pain. Okay, and the pain is unbearable now. And she gives no history of trauma. There is no significant past medical history or family history. राइट साइड का प्रोनेटर ड्रिफ्ट भी है. राइट का प्रोनेटर ड्रिफ्ट है और लेफ्ट के आपके पास हॉर्नर आ रहा है. यस, जब आपके पास रिलेटेड डायसेक्शन आएगी तो आप एंटीबायोटिक या एंटीप्लेटलेट दोनों में से कुछ भी कर सकते हैं. अच्छा, 40 years old woman is admitted with a history of unsteadiness and slurring of speech. एक मिनट, अनस्टेडीनेस स्वेलिंग ऑफ स्पीच है, worsening 3 months से, ठीक है. She complains of tremor affecting her right hand and diplopia on right lateral gaze, right की sixth nerve का pulse नहीं हुआ हुआ है. She has a past history of breast carcinoma, the arthritis. She smoked of 30 cigarettes. She is dysarthric and phonoscopy is normal. There is marked horizontal nystagmus, evidence of right 7 nerve pulse, right 6 nerve palsy, ठीक है. And there also appears to be mild facial weakness on right side. On testing hearing with Weber's test, louder note is heard on the left ear. ठीक है. राइट 8 नर्व भी गई, निस्टैगमस भी है, 6 भी गई है, फेशियल नर्व भी गई है. There is right intention tremor and dysdiadochokinesis. Tone power reflexes are normal. Lower limb tone power reflexes are normal. However, walk broad based gait चल रही है, मतलब cerebellar sign is leaning to the right. पड़ा हुआ है ना राइट साइड पे. राइट के ही इंटेंशन ट्रेमर डिस्टाइडोकोकाइनेसिस है. Walking broad based gait and is leaning to the right. Slowness of walking and tremor in his arms 19 years में, ये तो सीरम कॉपर यही चीज़ें जा रही हैं, ठीक है. Motivation, irritable nature, Huntington's भी हो सकता है ये. In this family history, mother is alive and well, father committed suicide, Huntington's है, ठीक है. And it's an uncomfortable state and with decreased social stress and mini mental score was 22. Normal tone was increased in the limbs with decreased speed and amplitude repetitive fine. Tone was increased in the limbs, decreased speed and amplitude of repetitive fine finger. Action tremor was also noted. प्लम्बर है, उससे चला नहीं जा रहा है. His wife reported that he has been more irritable over the past 6 months and had been increasingly forgetful. इरिटेबल है, 6 months से forgetful है, ठीक है, और hallucinate भी कर रहा है. मिनी मेंटल स्कोर उसका 18 है. Mild limitation of upgaze, supranuclear palsy. सुप्रान्यूक्लियर पाल्सी में हम क्या देते होते हैं? डायापिन और लेंजापिन एक ही चीज़ हो गई ना. अच्छा, डिमेंशिया विद लूई बॉडी है. ठीक है, डिमेंशिया विद लूई बॉडी में पार्किंसंस के फीचर्स भी अगर हों तो डायापिन ही देते हैं भाई. वो कह रहे हैं कि इसमें रिवर्स टिग्निंग है. कोई जवाब नहीं देना। ठीक है, 36 years old woman with known epilepsy is seen in the outpatient clinic. She has been taking carbamazepine as her only anti-epileptic medication for the last 3 years and has had no seizures for the last year. On her current dose, she is keen to start the oral contraceptive pill and comes to you for advice. Carbamazepine really and has no seizures. कार्बामेज़ेपिन ने तो जल्दी से उसको ओरल कॉन्ट्रासेप्टिव्स को ख़त्म कर देना है। अच्छा, ये आपके पास सबड्यूरल हेमाटोमा पड़ा हुआ विद मिडलाइन शिफ्ट। इमीडिएट मैनेजमेंट अनरिस्पॉन्सिबल ठीक है, हर कपड़े से हाइपरटेंशन की कार्डियक फिब्रिलेशन क्लोडिप्रीन है। Doxaban, and she is taking oral doxy for likely respiratory tract infection. There are coarse freckles at the right base, so she's not opening her eyes to voice painful stillness and groans incoherently. GCS come over, her lower limbs do not move in response to the. There is visible hematoma on the right temple. Intubation. क्या हो रहा है? 4, 5, 6 के सामने ही है कुछ। इसकी अपनी थ्रोट है क्या? ये बैक है, ये थ्रोट है आगे। अच्छा, 26 years old lab technician went vaccination for Hep B prior to the holiday in Thailand and 2 weeks later while in Bangkok. She developed severe pain over left shoulder and gradually subsided over next week. On returning home, she noticed increasing weakness of her left upper limb, for which she came to consult at Neurology. अच्छा, supraspinatus, infraspinatus, rhomboids, deltoid, biceps, supinator, सबकी ही पावर कम है, हैंड की पावर ठीक है। अगर यहाँ कुछ भी नहीं है। ब्रेकियल न्यूराइटिस, inflammatory, immune-mediated. 18 years old man presents to the GP with pain over his right shoulder. He says it developed suddenly a few days after he had received an influenza vaccine. Past medical history of motor includes mild asthma for which he uses salbutamol inhaler. ठीक है, पेन राइट शोल्डर पे है, developed suddenly a few days after जब उसने इन्फ्लुएंजा की वैक्सीन ली है। आर्म को भी नहीं उठा सकता और पीछे से वो उसकी भी इंजरी हुई है। Bringing of scapula तो आपके पास लॉन्ग thoracic nerve की होती है। Shoulder pain when he faces the boy and pushes Okay, there is venereal scapula on the right side, able to raise arm above his head. अच्छा रिपेयरिंग एनहांसिंग लीन पड़ा हुआ है. Malawi to 29 years old, admitted to 2 week history of weight loss, fever, difficulty walking in a normal speech. Focal seizures involving her right arm and right leg. She has mild right side weakness, ataxia, dysphagia, city multiple ring enhancing lesions in posterior and cerebellar hemisphere. HIV is positive, MRI confirms bilateral cerebral cerebellar ring enhancing lesions. ठीक है. Okay. Worsening headache, malaise, and were symptoms of dry cough and breathlessness a month ago, but this seemed to improve with antibiotics from GP. Temperature is 38. ठीक है, but there is evidence of oral candida. ठीक है, HIV है उसको और worsening headache, malaise, dry cough, breathlessness. Neck stiffness है and photophobia है. ओपनिंग प्रेशर बहुत ज़्यादा हुआ है, ये तो क्रिप्टोफोकल का लग रहा है. प्रोटीन्स बढ़ी हुई हैं. ज़्यादा है तो forgetfulness, agitation, and speech problem. MCU भी बढ़ा हुआ है, B12 तो ठीक है, HB भी ठीक है, MCU भी बढ़ा हुआ है। TSH बढ़ा हुआ है। Insomnia, sugar, weight loss, depression, forgetfulness, and pain and little sensation on his limbs. And he was given a limited trial, but over the next 8 weeks, it was noticed that he was becoming more forgetful and had become unsteady. Myoclonic jerks were observed and startled on touch when light was shown in his eye. Upward gaze was restricted, limb and gait ataxias were demonstrable, and plantar reflexes were flexors diffusely slow. स्ट्रेस एंजाइटी के साथ वर्सन हो जाते हैं।